So BCG has a long-standing history in the treatment of non-muscle invasive bladder cancer, and I believe that it actually will have a firm role for decades to come, largely because it is still very active. In fact, actually 70% of patients with carcinoma in situ will achieve a complete response to BCG. So it is very, very effective. What I see envisioned in the future is not so much that BCG gets replaced. However, BCG will be potentially augmented with the addition of other immune synergizing agents, potentially PD-1 antibodies. Immunotherapy in bladder cancer is here to stay, and I think it will be firmly established even as part of first-line therapy. Keynote 361, Invigor 130, these are two randomized phase 3 trials that are testing platinum chemotherapy alone, immunotherapy alone versus platinum-based chemotherapy plus immunotherapy. And I think many of us in the field feel or anticipate that platinum chemotherapy plus immunotherapy will be a new standard of care for patients in the first-line setting. However, even for patients who are not eligible for any chemotherapy, immunotherapy will still also have a role because we know that for majority of patients who can't tolerate chemotherapy, immunotherapy still remains a viable option.